Hello, I'm Woodrow Wilcox. I'm the Senior Problem Resolution Officer at the largest senior citizen-oriented insurance agency in the Midwest. I talk about the work that I do helping senior citizens with their Medicare billing problems and their VA billing problems. 5 rather serious matters came across my desk today, and without disclosing who they are and what their medical problems are, I want to tell you about these problems that are in our Medicare system. The first one is somebody who signed up for a Medicare D program, and that's the prescription drug program. The company didn't send him his Medicare D ID card so that he could just purchase at the local pharmacy and get the credit with the insurance company for his Medicare D program. So he kept asking for his ID, and he asked for the reimbursement papers. Finally, the company sent the reimbursement papers to him in August 2008 to be filed for the year 2007. So he filed them immediately, and then the company responded back, "You didn't file this paper in time, had to be filed by March 31st, 2008 for reimbursement of purchases made in 2007. Well, he didn't even get the form until August 2008. So we'll be working with him to straighten that out. Another person asked me whether or not treatment for eye care, in this case refraction, is covered by Medicare. I've written articles before that say Medicare does not cover everything, and one of the things that it doesn't cover basically is anything related to the eye or the hearing. Of course, if you're in an accident and you need service, of course it'll do that, but it won't help you with getting eyeglasses or getting hearing aids. And if you want more articles, go to my website, woodrowwilcox.com, where I've started posting the articles that I've been writing over 5 years about this subject. I worked on a billing problem for a client today, and I could not believe it. Right in the bill, the hospital admits that they filed the thing wrong the first time. It says claims lacks information needed for settlement, and that basically is code for saying they filed the claim wrong, Medicare would not pay on it and settle on it, and they're still billing the client as though he's responsible, when in fact all they have to do is just simply resubmit the claim properly to Medicare. But instead they're going after our client, and I'm going to be working to save the client several $100s on that. We have another client from Whiting, Indiana, got service at a hospital in Lake County, Indiana, but there's a medical billing firm or address being used from Chicago, Illinois, and I pointed out problems with the various bills. Here's part of the letter that I sent on behalf of our client. I phoned the client's insurance company about the bill. The representative told me that the insurance company never received a claim for 5/15/2008 with a total original amount of $6,660. However, the insurance company did get a claim and Medicare EOB for that date of service for the total original charges of $6,614. Medicare allowed $1,021.05 and paid $816.84. The client's insurance company paid your firm $204.21 by check, and then I go on to say, according to the bill that your firm sent our client, Medicare paid $772.21. According to the information that Medicare sent to the insurance company, Medicare paid $816.84. So you see, there's a problem with what the hospital is claiming it got paid by Medicare and what Medicare told the insurance company that it had paid the hospital. And these kind of billing problems always crop up, and whenever there's a billing problem where there's a balance due, instead of doing the right thing and correcting everything, many times the hospitals, the laboratories, the doctors will sick collection agencies on the senior citizens, and the senior citizens are browbeaten until they go ahead and pay the bill, a bill that they really don't owe if the Medicare system worked properly. Finally, this one is a real corker. A gentleman had a job, had insurance through that job, and then as he approached age 65, he was very conscientious about it and signed up for Medicare and bought a Medicare supplement policy. When he turned 65, his employer cut off his insurance and Medicare kicked in, but then just a few days after he turned 65, he had to go to the hospital, and he died. And all those medical bills that were generated after he turned 65, Medicare told the medical service providers to bill to Medicare and to his old insurance company, but his old insurance company canceled him on his birth date, and he didn't have that insurance anymore. So Medicare misdirected the bills to the old insurance company and has not taken the steps, months after he died, has not taken the steps to correct this billing error, And now I have to go to work helping to prevent the widow from having thousands and thousands and thousands of dollars of bills, and collection agencies and collection attorneys hounding her for a bill that should have been properly paid by Medicare and by the Medicare Supplement Insurance Company, but the Medicare Supplement Insurance Company didn't get any word of it because they were never directed, that billing information was never directed to them. So I'm working on all these cases. These are typical of the problems that exist with Medicare, and if anyone out there thinks that having a national health care system provided by the federal government is going to solve all our health problems, they just don't see every day what I see every day. And that when the federal government screws up, it screws up in a big way. And it causes a lot of problems for senior citizens, and I'm fighting for senior citizens. I'm fighting for fair treatment of senior citizens through the Medicare system and the VA system, which they're not getting right now, because I've got filing cabinets full of cases that I've worked on that senior citizens were not treated fairly by Medicare, by VA, and by medical service providers, all because of the screw-ups of the Medicare system. So if you want more information, go to my websites, woodrowwilcox.com and woodrowwilcox.tv. Thank you. Bye-bye.